students, welcome to All About Nursing channel. So today's video is going to about nursing care plan of a patient on diarrhea. Okay. So the patient who are suffering from diarrhea, the first diagnosis would be fluid volume deficit. So there is diarrhea means there is loose stool that is more than 3 times, and there can be chances of vomiting. Okay. So basically in nursing care plan, in my previous video you can see in the nursing care plan, first you have to write the patient's information, like the history. So complete history. After the completion of the history, there is medication, history of medication, the management, and after that there is nursing care plan. So first diagnosis would be the fluid volume deficit related to diarrhea as evidenced by frequent passing of stool, vomiting. So in the assessment, the first is subjective data. In this, there is a patient says that severe loose motion and excessive vomiting is there. In the objective data, we can see the how much or how many times the patient passes the stool, that is 6 times or 4 times according to your patient, and the number of vomiting. So there is profuse loss of fluids, so that can lead to fluid volume deficit. So the first diagnosis would be the fluid volume deficit. The goal would be to maintain the normal fluid volume, and the planning to assess the patient's fluid volume status, monitor intake output, and provide IV fluids as per the advice, and encourage patient to take more oral fluids and the fruits or the foods that contains more fluids, and provide medications that reduces the episodes of diarrhea or loose stools and the vomiting. So implementation would be the patient according to the planning. So implementation should be right like this. Okay. So the next diagnosis can be imbalanced nutrition, less than body requirement related to frequent vomiting, diarrhea, and loss of appetite. Okay. So the patient who are in diarrhea, so there is frequent passing of stool, and as well as there is vomiting. So in the patient who has the vomiting, so the patient has tendency to do not take any food orally, so that can lead to imbalanced nutrition. So so goal is to maintain the adequate nutritional status. We have to provide the frequent small intake of meal or the foods, and the food should be patient preferences that improve the appetite of the patient. The patient like to eat the food, so that kind of food that should be provided to the patient, and the food should be avoided which is gastric irritants, so that type of food should be avoided. Third diagnosis can be acute pain related to abdominal cramping or loss of electrolytes, so that can lead to acute pain. So in case of acute pain, so you have to reduce the pain level of the patient. So then the planning, we have to check the characteristics of pain, that is onset, duration, severity, intensity, location. Okay. And we have to in the implementation, we have to check the vital signs. Along with that, we have to provide a well ventilated, comfortable position and the calm environment that is stress free to the patient, and we can provide the dotaverine, or according to doctor advice, we can provide the medication that reduces the cramping. Okay. And other diagnosis can be, that is activity intolerance can be there, anxiety, knowledge deficit, that can be the other diagnosis of a diarrhea patient. So those are the major 3 diagnoses that I have discussed, that is acute pain. Okay. Next is the imbalanced nutrition, and the majorly that is the fluid volume deficit. And from the fluid volume deficit in a chronic case, that can if the patient persists fluid volume deficit, that can lead to decreased cardiac output.